আপনারা দেখছেন এনএন নিউজ 24। বিশ্ব যক্ষ্মা দিবস উপলক্ষে শান্তিনিকেতন মেডিকেল কলেজ এবং হাসপাতালে একটি প্রোগ্রাম অনুষ্ঠিত হচ্ছে। প্রতি বছর 24শে মার্চ এই দিনটি পালন করা হয়। এই উদ্দেশ্য হলো যক্ষ্মা বা টিবি রোগ সম্পর্কে সচেতনতা বাড়ানো এবং এই রোগ দূর করার প্রচেষ্টা জোরদার করা। এই প্রোগ্রামটি মঙ্গলবার দুপুর 12:30 থেকে কলেজের LT2 হলে অনুষ্ঠিত হয়। এখানে চিকিৎসকরা যক্ষ্মা রোগের প্রতিরোধ, শনাক্তকরণ এবং চিকিৎসা নিয়ে সহজভাবে আলোচনা করে। অনুষ্ঠানে MBBS এর সকল বর্ষের ছাত্রছাত্রী, JRSR এর ফ্যাকাল্টি এবং সদস্যরা উপস্থিত ছিলেন। কলেজ কর্তৃপক্ষ জানিয়েছে ভবিষ্যতে এই ধরনের সচেতনতামূলক অনুষ্ঠান আরও করা হবে।
Good afternoon on World TB Day. So, what can I say? Everybody knows that TB is the dark horse and many eminent people have suffered from TB. I can only talk about what India is doing for TB at present. We all know about the revised National Tuberculosis Program that was converted to National Tuberculosis Elimination Program in 2020. So, and we were supposed to eliminate TB, make India TB free by 2025. Have we done that? No. Why? Because there was this huge pandemic that happened in the middle. And what were the aims of that tuberculosis elimination program? The community medicine faculty will of course endorse this, that early diagnosis and treatment. So, with the help of WHO, we had started molecular diagnostics for tuberculosis free. You have all heard of CBNAT, cartridge-based nuclear amplification tests. So, diagnosis of TB molecular level with rifampicin resistance was put forward in the program, completely free. Then free treatment, totally free treatment, supplementation, nutrition supplementation এর জন্য some certain money was directly transferred, direct benefit transferred to the patients, and all this in an online mode. This was a huge program, but because of the pandemic and various other reasons, we have not been able to achieve the TB-free India by, definitely not by 2025. I don't know what the next goals will be, but we are all asking you to be aware, all the students who will become clinicians, to send patients suspected of TB to follow the program. Whatever benefit they can get from it, early diagnosis, a high index of suspicion, and early treatment, if the patient can get, then the containment of the diseases and elimination of the disease will be much higher. Thank you so much.
Good afternoon all. Thank you, Monak, for that wonderful introduction on the reason why we are all here today. We don't celebrate. We celebrate days, we celebrate birthdays, we celebrate anniversaries. Today is the day, a date, we just don't celebrate. We sit back, we take account of what we have done, what the disease has done to us, and what we need to do for the world in future. Tuberculosis has come to hit us in its new avatar. More drug resistance, more difficult and different investigation modalities, costlier, one more than the other. It is not the tuberculosis we knew when we were graduates. It's not the tuberculosis we knew when we started practicing. It is totally certain, totally different thing. Far more difficult to diagnose now, both clinically and by investigation, and also more difficult to treat. From all the subjects that we learn while we join our medical courses, there's not a single department which has not been dealing with this topic through years, through ages, yet we do not have an answer. It is so common. I recall an incident when one of our very reverend teachers, Dr. Paja from the Department of Dermatology in Medical College, was doing his MRCP in England, and then there was this patient of tuberculosis presented to him for his examination. None of the British students could identify. For sir, it was a cakewalk. He'd seen so many and dealt with so many of them. That and now, it is no longer a disease of just the poor, just the impoverished. It is a disease of the masses. It can affect any one of us, it still does. And yet, we're still grappling with the right medicine. We come up new ones, the drug gets one better than us. In this present situation, we, the medical fraternity, are trying to cope with whatever we have in our resources. The newer diagnostic tools, certainly not affordable to the common man, but yet it helps us to keep the score down. In the present situation, I hope we are all ready to take this disease and contain it like we did with poliomyelitis. I would request our fraternities, the faculties from the respective departments, especially microbiology and preventive social medicine, to come and say a few words on this. Thank you.
সকলকে জানাই শুভ অপরাহ্ন. Good afternoon to our honorable principal sir, sagacious HODs, revered professors and doctors, distinguished dignitaries, staff, and my fellow batchmates and seniors and other allied staff present here. আমি মৈনাক সরকার, শান্তিনিকেতন মেডিকেল কলেজ অ্যান্ড হসপিটালের প্রথম বর্ষের ছাত্র। প্রথমেই সকলকে জানাই ধন্যবাদ এখানে উপস্থিত থাকার জন্য, এবং ধন্যবাদ জানাই আমার আজকে এই গুরুত্বপূর্ণ অনুষ্ঠানটির সূচনা করার গুরুদায়িত্ব দেওয়ার জন্য। Today, we have all gathered here to observe a very crucial day in the history of medical science, World Tuberculosis Day, বা বিশ্ব যক্ষ্মা দিবস। প্রতি বছর 24শে মার্চ এই দিনটি পালিত হয় মানুষের মধ্যে টিউবারকিউলোসিস বা টিবির বা যক্ষ্মা রোগের সম্পর্কে সচেতনতা বৃদ্ধি এবং এর প্রতিরোধ ও নিরাময়ের বার্তা ছড়িয়ে দেওয়ার লক্ষ্যে। World TB Day is one of the 11 official global public health campaigns marked by the World Health Organization. 24th March commemorates the day in 1882 when Dr. Robert Koch, the one who we all know to have given the Koch's postulates, astounded the scientific community, announcing the discovery of the cause of tuberculosis. Tuberculosis is one of the deadliest infectious diseases out there. চিকিৎসা শাস্ত্রের অগ্রগতির সত্ত্বেও বিশ্বজুড়ে লক্ষ লক্ষ মানুষ টিবি বা যক্ষ্মায় আক্রান্ত হয় এবং হচ্ছে। ফলে এই বিষয়ে সচেতনতা ও প্রতিরোধ আগের চেয়ে অনেক বেশি গুরুত্বপূর্ণ হয়ে উঠেছে। World TB Day fosters awareness about the symptoms of TB and its prevention. It encourages prompt diagnosis and timely access to treatment for all. It emphasizes the need to build stronger healthcare systems and eliminate the social stigma associated with tuberculosis. চলুন আর দেরি না করে সর্বপ্রথমে আমি অনুরোধ করব আমাদের মাননীয় প্রিন্সিপাল স্যার অলোক শোভন দত্ত স্যারকে আজকের এই গুরুত্বপূর্ণ দিনটির উপলক্ষে কিছু বলার জন্য। স্যার প্লিজ।